Confused about how to get the COVID-19 vaccine in Minnesota? We're here to help. The vaccine rollout has been very hectic across the country. The situation in Minnesota is no different. If you're confused about how to get the vaccine, don't feel bad. Right now, that's normal. As of this recording, the state has around 835,000 vaccine doses on hand. 5.6 million people live in Minnesota. That's why the shots are only currently available to a limited number of people. You may have heard that vaccinations will follow a schedule based on categories like 1A and 1B. But here's what you actually need to know. If you are elderly and live in a nursing home or an assisted living facility, you can access the vaccine right now. The same is true if you work in healthcare. The vaccine is also available to a limited number of teachers, childcare workers, and people who are 65 and older. Minnesota health authorities say you don't need to contact your healthcare provider or your employer to get one. They should be contacting you by phone, text, or email to schedule an appointment with you. However, if you're still unsure and think you're eligible, there are more options. Anybody in Minnesota can register online at the state's COVID-19 Vaccine Connector website or by calling the hotline phone number. After you register, the state will notify you when you're eligible to receive the vaccine. The Vaccine Connector will also inform you of opportunities to get vaccinated near your home. If all else fails, try calling your local health provider or the health clinic you usually go to for treatment. You missed this opportunity and you're frustrated. A lot of people are experiencing the same thing, but that doesn't mean you won't have a future opportunity. Remember, we are in the very early stages of this process. No, COVID-19 vaccines are free to everyone. You also do not need to have health insurance to get one. Science tells us people can be reinfected with the virus, so health experts say you should still get vaccinated. The more people get vaccinated, the closer we achieve herd immunity. That means the virus will find it harder to keep spreading. Rigorous trials and studies show that the vaccines are widely safe. If you're one of the rare few who have had allergic reactions to vaccines in the past, the Centers for Disease Control recommends you skip the vaccine. Two vaccines are currently available, the Moderna vaccine and the Pfizer vaccine. Both require 2 shots. It's important not to stop after the first. Vaccines are currently not available to children. The Moderna vaccine is available to people aged 18 and over. The Pfizer vaccine is available to people aged 16 and over. Vaccines are expected to be available for children later this year. You don't need to share much information. You'll need to provide your name, age, and home address. If you're an immigrant, you do not need to disclose your country of origin. You also don't need to say whether you're fully documented to live in the United States. The state encourages you to disclose your race and ethnicity, but it's not required. This is to ensure vaccines are being distributed equitably. Do you have questions? Are you looking for answers to things you've been reading or hearing from friends? Send them to us at Sahan Journal and we'll get straight answers for you from health experts in our community.